How do you handle a situation where a patient experiences an adverse drug reaction? This is a critical question that often comes up in pharmacist interviews because it assesses your clinical judgment, communication skills, and ability to prioritize patient safety. The pain lists are not only looking for your knowledge but also your ability to remain calm, act decisively, and document appropriately. As a pharmacist, handling adverse drug reactions, ADRs, effectively is a vital part of your professional responsibility. In this video, we will explore how to approach and answer this interview question with confidence, provide a professionally crafted sample answer, and walk through a realistic clinical scenario to reinforce your understanding. By the end of this video, you'll be able to structure your answer confidently, avoid common mistakes, and give a compelling response that highlights your pharmacist-specific skills. The following are guidelines on how to approach this question. Employers ask this question to assess your ability to manage clinical risk, apply pharmacological knowledge, and communicate effectively during critical situations. They expect a pharmacist who can act swiftly, protect the patient, and follow up appropriately. Key skills to demonstrate include clinical judgment, problem solving, and effective communication with patients and healthcare professionals. Avoid statements like, "I would just stop the medication," or "I'd refer them to the doctor immediately," without further explanation, as these can appear passive or incomplete. Also, avoid being vague, blaming others, or failing to acknowledge the importance of documentation. Instead, focus on assessing the severity of the reaction, taking immediate safety steps, and communicating with the patient and care team, as these are central to patient-centered pharmacy practice. A strong response should include identifying the ADR, assessing the patient's condition, documenting the event, and reporting it to relevant bodies. If you follow these steps, you'll be able to demonstrate that you can manage complex clinical issues effectively. Finally, knowledge of local pharmacovigilance systems and professional guidelines on ADR reporting is essential, as it shows that you're compliant with professional standards and committed to patient safety. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. If a patient experiences an adverse drug reaction, my first step would be to assess the severity of the reaction and ensure the patient's immediate safety. I would stop the suspected medication if appropriate, provide necessary first aid, and refer the patient for further medical evaluation if needed. I would also document the event in the patient's record and report it using the appropriate ADR reporting system. Next, I would inform the patient about what happened, reassure them, and discuss safer alternative therapies. I'd then follow up to monitor their recovery and adjust their medication plan accordingly. This approach ensures patient safety, professional accountability, and continuity of care. Example scenario. I remember when a patient came in with a rash and swelling after starting an antibiotic. I calmly assessed the symptoms and identified that it could be a hypersensitivity reaction to amoxicillin. I advised them to stop taking the medication immediately and referred them to their GP for urgent review. I documented the incident clearly and submitted a report through the National Pharmacovigilance Portal. Later, I followed up to ensure they were recovering well and that a safer alternative had been prescribed. In conclusion, understanding how to respond to an adverse drug reaction is not only crucial for passing interviews but also for ensuring patient safety in real-world practice. Thanks for watching.